aren't there clearly cultural differences depending where you are in the world, the whole perception of a woman and their menstrual cycle and PMS and how it's perceived, not only by her, but the people around her?
So there's actually been a lot of studies done in this, especially in the last 2 decades across different countries in the world. And in general, we don't find that women are reporting PMS symptoms, not PMDD, because we'll discuss that separately. They are not the same thing. PMDD is actually a psychiatric diagnosis. PMS is that syndrome of collection of hundreds of symptoms. Women from many cultures and many countries do not report PMS. And when we look at people who have come from other countries into the United States, it appears that the more time they've spent in the United States, the more acculturated they become to U.S. mainstream culture, the more they start to report PMS symptoms. So sometimes we call that a culture-bound syndrome, meaning that it happens more in certain cultures than others, and sometimes not at all in other cultures.
Can you differentiate, because I do think it's important when you talk about PMDD?
Yes, absolutely. So PMDD is an official diagnosis in the Diagnostic and Statistical Manual. It's the one that psychiatrists and psychologists use to officially diagnose mental health conditions. And PMDD actually wasn't in the DSM just several years ago. It was actually sort of filed under a more generalized other types of depressive disorders. Now it's its own condition, and it appears that the committee has actually spent a lot of time going through the criteria to make sure that it can really be attributed to a woman's cycle, meaning that it has to be symptoms across at least 2 cycles, that when the symptoms appear, and there's a collection of 11 symptoms and you have to meet at least 5 of them, that they have to appear or have its onset just a few days before the onset of your menstruation. And then after the onset of your menstruation, it's supposed to start decreasing, and that you have to track this very carefully. And they caution any clinician using this diagnosis that they absolutely have to follow that formula. Of course, in reality, we don't see that happening. Oftentimes in reality, people are just saying that looks like PMDD or it looks like PMS, and they conflate the 2 things, and they're not the same.
I do want to bring into the conversation OB-GYN Dr. Neetu Sodhi, because, you know, if you're an OB-GYN here in America, when you think about PMS and PMDD, can you give us your perspective as an obstetrician gynecologist?
Well, as an OB-GYN who evaluates and treats these conditions on a daily basis, PMS and PMDD are very real. They're conditions that we deal with on a daily basis. Not everyone has PMS, though. I think we're alluding to people having symptoms along with their periods as having premenstrual syndrome, and that's not the case. Premenstrual symptoms are very common: bloating, nausea, headache, even irritability, but these don't cause enough distress in the majority of women to even constitute premenstrual syndrome. So there's a small subset of women, less than 5%, who actually get enough distress to be called as having PMS or PMDD. And for these women, their response to normal hormonal fluctuations is in fact exaggerated, and it warrants further evaluation and treatment. There's a distinction and a progression between PMS and PMDD, as has already been discussed, but they're very important parts of women's lives.
And I'm glad that you're mentioning the prevalence, because as you were talking about PMS, you're saying in your practice, for example, you're thinking it's maybe 5% of women that would have the types of symptoms that would look like a premenstrual syndrome. Now, in most reports that you read, a lot of actually from very good journals, they'll say that 3 out of 4 women experience PMS. And I think that that's definitely an overgeneralization and probably overstated, because again, I think people sometimes conflate having a few of those symptoms as meaning that they have some kind of syndrome, or worse yet, a PMDD diagnosis, which I see as very different.
I think that's why it's important to further talk and legitimize these conditions as real, so that we can understand how to correctly diagnose them and identify women who are in actual need of treatment, rather than just women who are blaming their life stress on their period and having normal premenstrual symptoms that aren't so distressing.
And I do want to be very clear that when we talk about a culture-bound syndrome, it doesn't mean that it's not real. Culture-bound syndromes are very real. It's just that we see them more often in certain cultures than others. For example, bulimia nervosa is one of these culture-bound syndromes. We see that anorexia occurs in very, very many countries in the world. Bulimia, not so much. It's mostly in westernized countries, yet it's obviously a real condition. It's in the DSM. It requires treatment. There's a lot of research behind it.